So today I wanted to visit a little bit about my personal medical history so that people kind of understand a little bit about why I do what I do. And today's kind of important because I am going to see a new cardiologist for the first time in a while. And I've seen a cardiologist since I was about 14 years old because I started having these things called syncopal episodes, which is where you will pass out. So when patients tell me that they feel weird or they've passed out or they think they were going to pass out, and I usually kind of relay to them what used to happen to me. I'm like, did you lose your hearing first? And then your vision got spotty and then it went black and then you wake up on the ground. That's kind of how mine went and how that happened for me. So today I get to go see a cardiologist again and establish care with a new cardiologist. So that's what I'm doing today. And what people sometimes will ask, well, first off, this is what I'm taking with me because I've called the cardiology office how many times now? 3 or 4 times. Ask if my records were received there, and you gotta love healthcare. They were never received. So I'm taking a backup playing with me today so that I have all of them, and I have my computer with me too, just in case. I get a lot of questions, but I wanted to see if we could kind of field some of those questions today.
Why do you do what you do?
So most of what I do, obviously, for pregnant individuals is to try to help them advocate for themselves in their pregnancy. And for me, when I was younger, teenager, I started having these episodes of passing out. And they sent me to multiple doctors. And usually, actually, when I passed out, I would just show up in the emergency room and they would tell me to drink pickle juice because they said my blood pressure was low sometimes. And they always asked me if I was diabetic or pregnant. So for someone who was 14 at the time, I had never had sex. And it was very interesting for the physicians to kind of push that on me. And they wouldn't believe me. And they kept running pregnancy tests every time. So that was weird to be the patient and have a physician not really believe you when you talked to them. That was very strange and odd. And then the diabetic part, they just always screened me for blood sugars and they were always fine. I also ran track at the time. And so I was about the same height I am now, which is about 5'8", but super slender because I had gone through like a growth spurt. And they always were like, well, maybe you're anorexic. So no one addressed my heart. And I think that's part of my big passion about advocating for yourself, whether you're pregnant or not, particularly in women's health and in individuals who have heart issues, because your heart obviously is not on the outside of your body. And so if you have a heart issue, sometimes people don't take you seriously. Though when you say, I feel dizzy, I feel tired, I'm passing out, they go to, and they being the providers, they go to, oh, you have an eating disorder, or oh, you have diabetes, or oh, you're dehydrated. They don't usually go to, oh, you might have an underlying heart condition. So when mine finally did get diagnosed, I was probably closer to 18 years of age. And so that's when this started, when I started collecting the records as best I could. So I have EKGs, which are electrocardiograms. I have echocardiograms in here from when I lived in various different states. And I take them with me because I can't get them faxed most of the time. And then you're just telling your story. And now I know as a physician, you really do need to have those actual records. So I keep a folder. And this is just my cardiac folder, by the way. I have one for my pulmonary stuff and all these other things. But what's interesting, I think, is that people that have heart issues sometimes are not taken seriously. And particularly if you're younger, unfortunately, particularly if you're a female, women are underdiagnosed for heart attacks because when they go in, they are oftentimes dismissed and it's said, oh, you're having anxiety. The other thing, women of color, individuals of color in general, are not taken as seriously and are not treated as appropriately as other individuals in general. And we just have data for that. So my goal is just to try to have people advocate as best they can.
What kind of heart condition do you have?
Yeah, so my condition is actually kind of interesting. They didn't have a good handle on what it was when I was younger because my main symptom was syncope, which is just passing out. And they couldn't figure things out. So they did this kind of cool test when I was maybe 17 or 18. It's called a tilt table test. And they literally lay you down and put all these little like stickies on you and have an IV in you. And you're meant to lay flat, relax. You can't talk. You better like be super still. And they stand you up, but you're strapped to the table so your muscles are not engaged. And they wait for you to pass out. This is the weirdest thing. And they have monitors on to look at your blood pressure, your oxygen saturation, those types of things. I did that when I was a teenager and then again sometime, I think in my early 30s. And I passed out like a champ. So they monitor you and then they'll give you some fluids to help. Basically, I used to like to say, bring you back. Right? You pass out and then you wake up. you don't know what happens when you're passed out, when you don't have any, they call it loss of consciousness, right? Like you don't know what's happening. Basically, my blood pressure would just go down to basically nothing. And then I would pass out and then I would wake back up when they lay you down. So that was part of the concern at the time. And then with the ultrasounds they did on my heart, they actually found out that the muscle of the heart was thickened and it had been working too hard. And also that the squeeze of the heart was lower. And so the squeeze of the heart is called your ejection fraction. And you want it to be a certain percent. And mine was half of what it should be. So all of those things together, they felt like there was an infection that could have gotten in the heart at some time. And they call that a myocarditis. And so that's what basically they thought I've had, was some type of a non-ischemic, so not having an issue with blood flow to it, and non-ischemic cardiomyopathy, and cardiomyopathy meaning the heart being larger, with a component of myocarditis or an inflammation of the heart at some point. So that was my diagnosis. Having that diagnosis, but not being older, not being male, and not being obese has put me into this place of having to fight all the time to let people know, hey, if I pass out, keep me laying down, elevate my feet, I'll be okay. And they actually did say that the passing out might not have had something to do with the heart. They could be two separate things. But trying to tell your mom that when you're in high school and you pass out in front of her and she sees you on the ground for sometimes up to 30 seconds to a minute or two without consciousness, right? That's kind of hard to explain. So mine is non-ischemic cardiomyopathy. And because of the squeeze being an issue, over the years, they found out that people that have something like what I have need to be on a medicine for life. So the way that I kind of think about it is this: I also have tachycardia, like a baseline tachycardia, so my heart beats too quickly. And that could be part of what was going on with this. I think it's hard to really tell all of it together. But the issue with it is that if your heart is beating faster and then you think, okay, I'm going to live to be 100, take all of that amount of time and add up the beats per minute, it's going to be a lot. So if you can slow down the heart a little bit and take your number of beats per minute down from 100, which is kind of where I was, down to about 70 beats per minute, that's 30 beats per minute I'm saving just in a minute. But then take that over weeks to months to years, it basically is going to get you some of the longevity back on your heart. So I will always be on a medication. And so no laugh, this was actually in my purse today because this is part of my daily regimen. And thankfully, my parents always are kind of laughing recently. This is just Sunday through Saturday, but someday I'll probably have Sunday through Saturday AM and then Sunday through Saturday PM maybe. But I will always be on something for my heart that will allow me to not have a heart rate that's too high and to try to help with this issue of the contractility. Those medicines have changed over the years. And the current one is a beta blocker. And I'll tell you this, beta blockers do have side effects. And so that's part of this. When we go hiking, let's say, and we're with a group of people, I'm in my 40s. So if we're with a group of people that are in their 60s, they are up that hill and back way before I am. And what happens is it doesn't allow my heart rate to go up like most other people. So when I used to work out not on a beta blocker, my heart rate will go up, I'll sweat some, I'll get going, and that's great. And now if I want to exert myself more, the heart rate won't really go up as high. So it makes it harder for me to do some of that activity. So that's part of the struggles that I have, that when I travel or people are like, let's go hiking. That actually happened when we went to Colorado around COVID time. And I had actually had COVID, was still recovering. We didn't know a ton about COVID back then. And my lungs just really weren't that fantastic. And so when everyone was hiking, going up the mountain, I had to stop and then come back down. I just couldn't catch my breath. And when you're on this type of medicine and your heart rate won't go up, you've got to at some point be able to fix that so that your cardiac output, or the amount that's going through your heart to make you be able to function, right, that it keeps up. So at one point, to make that happen, then my respiratory rate goes up, meaning I'm having to breathe heavier. So then it looks like I'm hyperventilating and then people freak out. So I don't want to do that to them. But that's been part of the struggle with this, is just being at different things around people and them hiking up a mountain and then doing things that I just can't do.
Does your heart condition impact your ability to become pregnant?
When people have diseases or issues that others can't see, sometimes people just don't know about it and they can make false judgments or just think that they kind of know what's going on. So Individuals, since that's what I do now for my job, right, is high-risk pregnancies, taking care of people who have medical issues that become pregnant, or people who are pregnant and then develop a medical condition, or people who have a fetus or a pregnancy that has an issue with the actual pregnancy. That's what I do. When someone comes to me for a preconception visit saying, hey, I have these medical conditions, I would like to have kids, what are my risks? My job is to tell them the risks, and then they decide if they want to accept those risks. For people who have heart issues, particularly those who are on medications, their risks can be higher. And thankfully, I've never had to have any heart surgeries. I have had what's called an ablation, where they go in through sometimes your groin, sometimes now they go in through a vessel that's right around your wrist. And they try to find a place in the heart to ablate or kind of burn so that your rhythm of the heart can stay normal. So mine in the past would be abnormal. And it's been more normal now that I'm on certain medications and lifestyle changes and things like that. But for individuals with certain heart diseases, particularly when that functionality of the heart, the squeeze of the heart is not so good, it really can increase the risk of their morbidity and mortality, meaning risk factors they have in a pregnancy for getting a clot, risk factors for getting an arrhythmia where the heart rhythm just goes haywire, and also then mortality risks for death. And so I know that those risks are high when I counsel a patient. So I know that those risks for myself are high. I also used to be on 5 different medications for lung function, and I got a pneumonia and got really sick from that. So all of those things together, for me, it wasn't a risk that I wanted to take. And I feel like I kind of have had tons of pregnancies through my friends and patients. So I've seen them go through things. I've talked with them about their pregnancies. I've gotten now to see their kids grow up, which is awesome. And that's fun for me. And I had 2 nephews who I love and adore. And I got to help my sister with her pregnancies as well, which was also kind of fun. So I think there's a stigma out there for 2 things that kind of I'd love to address. Number one, that I have had people tell me, you're probably not as good of an OBGYN or a maternal-fetal medicine specialist because you don't have kids. And my argument with that is I don't go to my cardiologist, who I'm going to see today. I'm not going to go ask her, first off, excuse me, do you have a non-ischemic cardiomyopathy? Because if you don't, you're not going to be as great of a doctor to me. That's not fair, number one. And number two, that's not true. That doesn't make this doctor I'm going to see a better physician if they have had exactly what I have, or if they have something related to the specialty that they're in. So that's thing number one. And then thing number two, for individuals who have cardiac disease or any kind of disease and they choose not to have children, that's a choice. So just because you make that choice doesn't make it a better choice or a worse choice. It's your choice. And so for the people in the past who have told me that I'm not as good of a physician in caring for pregnant individuals because I've never had a pregnancy, I just don't really think that's true. So I do my best with patients. I love caring for individuals within this space. And I do have like a really, really subspecialized love for individuals who have cardiac disease because I feel like they are underserved. They are sometimes pushed aside, and I know how that feels.
What do you do differently on a day-to-day basis given your cardiac issues?
So I said at one point too, and I've always mentioned like lifestyle modifications, which are super important for people with heart issues like myself. One of the big things is caffeine. I don't smoke, so tobacco can be an issue. But caffeine is a big thing. And today, I know I've had too much caffeine, but I usually will have 1 cup of coffee a day, and then later in the day, I'll do decaffeinated coffee. And I've talked to them about caffeine in pregnancy in and of itself, but even outside of pregnancy, it takes your heart rate up, can make you feel shaky, those kinds of things. Decaf coffee actually still has a little bit of caffeine in it, and it's different depending on the brand. So I'll typically have 1 cup of coffee a day. Usually don't do ice, but it's over 105 today, 110, something like that. So I'll do 1 cup of coffee, and then later in the day, if I want to have something, I'll do decaf. But I have to stay super well hydrated. And I always talk to my patients in pregnancy, you have to stay hydrated, regardless of if you have an underlying medical condition or not. So I drink lots of water during the day. I limit the caffeine that I have as well. And then I like dark chocolate, which has a lot more caffeine than milk chocolate. And I really have to limit that if I'm having something sweet because it has more caffeine in it. So yeah, careful with those.
What suggestions do you have for patients to help them advocate for themselves, particularly with heart issues?
I think one of the big things to advocate for yourself, keep your records if you can. Understand that if you have a condition that no one can see, like I always tell people too during pregnancy, if they have something where they need to take it easy and they're like, well, what does it mean to take it easy? I will say, even when you're pregnant, if you have a complication, people don't know what your complication is if it's internal, right? Like if it's your heart or your lungs or whatever it may be. So sometimes I talk to people about act like it's external. Like if you had a twisted ankle or a broken ankle, would you do that thing, right? So would you go hiking? Would you go run errands for 4 or 5 hours? You wouldn't do those things if you had a twisted ankle or you were on crutches or had a broken leg, right? So if it's something internal, sometimes I tell people to think about it that way and just advocate, know your body and know what's going on. And don't take offense if people aren't advocating for you. Advocate for yourself. I've taken it on as my job, and as corny as it is, like I will keep calling that doctor's office and make sure they have it. And the excuse of we're a big office or I can't find it, that's your job. And when I'm working as a physician, it's my job. So when I have staff, I'll say, I need those records. Let's get them before the patient's here. I just think it's really important to be able to have a voice. And if it's something someone can't see, you can explain it to them and just have patience with them.
What lifestyle changes have you made to be as healthy as you can?
Hydration is big, number one. Number two, going to the doctor regularly, making sure that I keep up with all the appointments that I have to go to, which is such a hassle, but it's part of what I need to do and what everyone probably needs to do. And then thing number three is rest. So for me, it was a lot when I say lifestyle changes for what I have going on, it was getting on a good schedule of having sleep. And as a physician in the field I'm in, I used to take call and be up for days at a time, just not healthy at all. And as the patient, I wasn't listening to my doctors very well. They're like, okay, you need to sleep, 10 hours a day, every day. And when you're on call for 72 hours at a time, you might get a 30 minutes of sleep here, an hour of sleep there. And I kept working through that. And I was having PVCs, which are premature ventricular contractions. I was going into SVT, which is supraventricular tachycardia, episodes of that. And I was having AFib, which is atrial fibrillation from time to time. So I wasn't listening to the doctors. And for me to be a doctor and get frustrated when my patients don't listen to me, when it's as simple as get sleep or drink more water, I wasn't doing that. And so I had to actually change the way in which I practice. So I don't take night call anymore because I have to sleep so that during the day I can work really hard and take care of patients in a fantastic fashion. And I will tell you that from a professional standpoint, the pushback I got and felt from people in my community wasn't always awesome because you go to school for so long to do this subspecialized area, and then you're having to talk to people about, hey, I need to not take call. Hey, I need to get sleep every day. And you're kind of looked at as, well, you're not working as hard. And that's also something that personally that we do to ourselves as physicians and professionals and in any job. We just decide or we think we're not worthy because we're doing something different, whether it's how people treat us, what they say to us, or just our own narrative in our mind. And I had to work really hard on changing that. So part of what I do is also mental health. I make sure that I check in with someone once a month and say, hey, here's the story I made up in my head. And here's the narrative that I have. And, oh, that does make sense, or oh, that doesn't make sense. And kind of letting go of the outside world judging or me thinking that they're judging certain things, because I have changed my lifestyle and it doesn't happen overnight, but the water I drink is increasing. The sleep I get is better. My schedule's better. And I'm still able to care for pregnant individuals and help individuals now even more, I feel.